The CDC says symptoms for COVID-19 may show up 2 weeks after exposure to the virus. So if you or someone you know traveled for Thanksgiving, well, you could still be symptomatic this week. So what do you need to care for someone who is sick with COVID-19? 10 Tampa Bay's Tweelon Wynn shows us some supplies that you probably already have on hand, Tweelon.
Caitlin, good morning. Most people who get COVID-19 aren't going to need to go to the hospital, so they're going to be at home recovering from those symptoms. But the good news, like you said, is the things that you are going to need to feel better, you likely already have.
The best case scenario for treating someone at home for COVID-19 is giving them their own room. No one else can come in, even pets. They'll need their own towels, tissues, and dishes. If possible, give them their own bathroom to use to avoid spreading the virus to other people in the home.
We have to prevent them from getting infected. That's the worst thing any of us would ever want to do.
Do the sick person's laundry and dishes separately and in the hottest water possible. You'll want these things for your at-home care kit: safety and cleaning supplies like bleach, plastic gloves, soap, and face masks.
When you're infected, you should wear a mask around your loved ones as much as possible. If you can't wear a mask, they should wear a mask to protect themselves.
As for medicines, here's what you'll need.
You treat the symptoms that they have. So if they've got a fever, you can take some Tylenol. If you've got a cough, you can take some cough medication. So typical over-the-counter medications.
Some other important things for your kit: multivitamins and vitamin C supplements, fresh fruits like bananas, apples, and lemons, as well as honey and some soup.
Eat and drink so that you stay hydrated. The worst thing you can do is stop eating and drinking and lose a lot of weight, and your body gets even weaker.
And if you are home with someone who has COVID-19, you should be isolating as well. Don't go out, don't go to work to risk spreading it to other people. And you can safely end that isolation for both of you if it's been at least 10 days since your symptoms first started. And if your symptoms have improved. Another sign you're going to want to look for is a fever or no fever for 24 hours at least without taking any medication at all.